Very good afternoon, friends. I am Dr. Ashish Kumar Agarwal, international cardiologist at Apex Hospital, Bareilly and Rhythm Heart Center at Bareilly. As we know, hypertension is a very prevailing problem at present, and around two-thirds of the patients cardiovascular disease died because of cardiovascular disease and other non-communicable disease in India is a very significant number, and most common cause of this cardiovascular disease is hypertension. As we know, around 30% of the patients are hypertensive now, above the age of 30%, 30 years, and females are also equally affected now. So this is a very huge burden on Indian economy as well as cause of the death in India. So what is about latest things in the hypertension? As we know, hypertension is known from very beginning, and it is known that 50% of the patients remain undiagnosed and 50% of the patients not treated properly, or 50% of the patient not get proper treatment. So according to the newer definition of blood pressure, anything above 120 to 129 systolic blood pressure and 80 to 89 millimeter of mercury is known as elevated hypertension. And stage 1 is more than 130 systolic and 90 diastolic. And similarly, stage 2 is more than 140 and more than 100 millimeter of mercury. So this is the latest about the hypertension, that we have lowered the limits of the hypertension to start the medicines. And also it has been noticed that starting medicines early and to adhere with the medicines lifelong reduces the mortality, cardiovascular mortality, as well as other complications can be reduced. And it is very interesting in the COVID period that has been shown that metoprolol reduces the lung inflammation in COVID positive patients. And post-COVID, it has to be given at least for 6 to 1 year, 6 months to 1 year. One more important aspect of newer treatment in hypertension is that ambulatory blood pressure monitoring. So as we know, we have to, it is traditional to check BP in the daytime, in the office time, or in the doctor's clinic. And most of the now digital machines came up. So people are now checking BP in the home also. But ambulatory BP monitors is a very new concept, and it recorded the blood pressure every 50 minutes or 30 minutes. So, and it also keep recording in the night. So it has been noticed that 10 to 20 millimeter of mercury blood pressure variation in the night is significantly associated with higher mortality in hypertensive patients. So it has been recommended for those patients who show daytime variability. So we have to record blood pressure in night also and treat it accordingly. So we have to switch the medicines in night doses to reduce this variability and to reduce the mortality and to control the blood pressure in better form. And there is also newer medicines came in calcium channel blockers, newer ARBs, and newer medicines are now come up to control the blood pressure. But basically there are 5 classes of ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and the diuretics. These are the medicines known to us, but we are less vigilant to give these medicines. And sometimes patient also forget to take medicines. So it's better to give the OD formulations and to give the combination like beta blockers plus ACE inhibitors plus diuretics, or ACE inhibitors plus calcium channel blockers. These all combinations are now available. Even the triple combinations of beta blockers plus ACE inhibitors or ARBs plus diuretics are now available. So this is about the newer things in the blood pressure, like lowering the blood pressure limits. Initially, it was thought that 130 is the limit. Now, one study showed that lower limit 110 of millimeter of mercury to keep the blood pressure around 110 by 90 or 110 by 80 reduces the mortality. So now newer limits have to be reduced to control the better control of the blood pressure. And also the most important and the first thing is to reduce the stress, to maintain the diet, to reduce the salt intake, junk food intake, alcohol, tobacco. These are all causes of blood pressure. The first and foremost thing in blood pressure is to control the diet, exercise, reduces the fat intake, to control the blood sugar, and to reduces the anxiety or stress. These are first and foremost thing. And to add on medicines, we do not hesitate to start medicines. And these medicines are very good in controlling the BP as far as the blood pressure control. And also they are very least likely to cause any side effects. And these medicines can be safely taken uh, without any testing, frequent testing. We can do testing around like creatinine, sodium, potassium, and other heart rate monitoring at 6 months, 3 months interval. But we have to adhere with these medicines as long as our physician or cardiologist continue these medicines. Thank you very much.